working lower back, for me, one of the priorities is often to create more space. Obviously, it depends with lower back pain, the reason behind the etiology of why it's here in the first place. Is it compression? Is it degenerative? Is it functional? What is the cause? But in a lot of cases, what I've got to be considered accomplishing is about creating more space into the lower back. So rather than doing transfer stuff right off the bat, I will try in the first instance to create that elongation through the back. Now, you can use multiple techniques. You can use your myofascial release, your deep strokes, your STR, your MET, all sorts of choices there. But the idea is to create that space. So from an STR point of view, I'm going to create my lock into the sacrum area. Now remember, this is not got a lot of muscle mass here in the sacrum, so my angle is quite shallow, and my depth, again, is quite shallow. So I'm just lock enough, and then take up my slack, and then I'm going to ask my client to press forwards. David, could you just, yes, exactly. So as I'm pushing that way, he's going to flex his hips anteriorly forward this way. And here I am getting in to my sacrum, and David, press forward. Good. So I can take that, press forward, David, and move along the whole of the crust area of the pelvis, or I can do this bilaterally. Sometimes there's a rotation, and because there's a rotation, you just want to do unilateral rather than bilateral. The idea, though, is to, as you're locking and going in one direction, that your client is able to anterior flex the hip. Now, some people will find that easy to do, other people will not, and therefore you will want to switch around and go in the opposite direction, pressing down here instead of pushing up in the front. So alter to the other direction. If you've got somebody who is unable to perform the anterior tilt, move into or a posterior tilt, move into an anterior tilt.